game. So many people leave Loreto because they feel they don't get enough medical support, and maybe there's a way we could change that. So he's saving that for the end of it. I do want to embarrass him a little bit. I looked on Facebook and oh my gosh. Sarah Craig, Dr. Salinas helped my husband with a medical emergency February 23rd after he suffered a grand mal seizure in the middle of the night. I posted a plea for help. Dr. Salinas spoke on the phone with me and he was there at the hospital in 10 minutes. The typical story. He spoke to the hospital doctor, read his chart, examined him within 20 minutes. He provided the options, one of which was to help coordinate a medevac transfer. And it turned out my husband had a brain tumor. It was life-threatening, and the Mayo Clinics removed it 3 days later. He followed up with me once we were stateside. I would see him as a patient if I lived in Loreto. He's a wonderful, kind person and doctor. He's a great doctor. I trust him with my life, says Barbara Vandenberg. Awesome, really excellent doctor. My brother had a problem with his inner ear. 2 doctors in the US basically did nothing. He went to Dr. Salinas and the issue went away in 2 days with his prescription. Here's a big shout out for from Mary Ann Austin saying, thank you for his continued compassion and expertise through my continued long saga, broken elbow, subsequent surgery. I can't say enough about how it helped to have Dr. Salinas so readily available for everything I needed, including advice, care, and ease of handling all doctor, surgeon, scheduling, and communications. And they go on and on. Our gratitude for his professionalism, sensitivity. He attended my husband with an excellent consultation and successful surgery, says Ma Elena Posadas. I'm writing this for all of you who wonder about medical care. This is a long one. I'm not going to read the whole thing from Sherry Boken, but she almost anaphylactic shock. She almost died, and it was Dr. Salinas that saved her life. So you can see these yourself. Leslie Samuels, who is not with us now, said she's so glad she signed up. She needed emergency surgery. He responded right away, took care of everything. I'm so lucky we have him in our community. So we are so lucky we have you in our community. Keep it up, and everyone stay safe for the next hour. We have
Thank
two
you very
seats
much.
here.
I really, really appreciate it. You don't know how important it is for me to see that we have tried to make the change as years went by here in Loreto, and knowing that it has made a difference. It might be a little, it might be a lot, but at the end, it's my main goal. So I really, really appreciate everybody for coming in, and I hope this talk helps you understand a little bit of what this side of being a doctor is all about, especially here in Loreto. Okay, so the name of the presentation that I wanted to put is an organizational structure of the health system in Loreto. I know a lot of you already know how it is, but for the ones that don't, I'm gonna try to explain as easy, as fast as I can, but feel free to ask if you have any question about any of the slides, okay? Okay, so talking really, really quick about the definition of health, I really like this saying because it is according to the World Health Organization. And it says that health is a state of complete physical, mental, and social well-being, not just the absence of disease. So this is conceived as a human right. Everybody deserves this. Okay, next one. So just to jump ahead and really quickly start on the main presentation, how has the health system been formed in Mexico? For the ones that don't know, Mexico has a health system divided into what it is a public and a private sector. Okay, we can get public and private as probably other countries, but in here it's a very good, very specific division between public and private, and we're going to talk about you. How many people? How many people have seen these logos in Loreto? Are you able to identify what it is? If I can go in, I can. Have everybody seen this logo?
Yes.
Where have you seen it?
By the police.
by the police station, exactly. How about this one? It's actually on the main road, on the Salvatierra,
By the university.
by the university, exactly.
By the fire department.
How about this one? This was used to be like that, it changed now, but it's the one on the main hospital, on the main entrance. It used to be called like that. It has changed over the years because of the main government, but and there's other ones that are not in Loreto, but still the public sector. Okay, the next one. Okay, so for Mexican Constitution, the government should, this is focusing first of all on public sector, public facilities. So the public facilities should provide quality medical care, medicine and medical supplies, everything. They should take care of everything. Be free and universal. It says on the Constitution. Offer health services to the formerly employed population. And like we were talking in the slides before, promote the participation of the population in self-care. There's exceptions, because as you can see, there's a very important question wording here, which says free. There's exceptions, which we're gonna talk about. Okay. The problem with this is that's expectation. The other thing is reality. Okay, and that's what we're gonna talk about, because if this would have Loreto, I wouldn't be standing here right now, to be honest. Because if everything was fulfilling in this with my patients, I would say, keep it up, keep up with a good job, government. But the truth is, as every country probably, we have good things, we have bad things. And that's what we're here for, to explain you exactly what can be done in here and what can't. Okay, so the main three public institutions that offer health services to the population are the one that we just listed before, the IMSS, which it's IMSS, ISSSTE, and nowadays there's another one called IMSS Bienestar. It used to call in the past INSABI. Before that, it was called Secretaría de Salud. They have changed it because of the current administration. But at the end, it is the three main institutions that take care of public sector, which is these three: IMSS, ISSSTE, and IMSS Bienestar. The IMSS Bienestar is the one located, and is the only one that has a hospital here, which is the one on the main entrance that you see. The first thing you see going into Loreto, it's a big, considerably big hospital. That's the IMSS Bienestar. The ISSSTE located next to the police station, and the IMSS located next to the college or university. So we're gonna talk about each one and what they can do. IMSS Loreto, that's the facility. The next one, that's the facility that we have here. For the ones that don't know, this is the main road, Salvatierra, and you will see it on the main road. Okay, so who can go there? If I get sick, if anybody of you gets sick, do you think you can go there? Residente permanente, that's one.
If you're paying into Social Security in Mexico.
Exactly. We'll see. Well, next slide. This is one of the facilities that you can actually go in as long as you fulfill a very important requisition, which is self-employed people who voluntarily join. You can pay an annual fee to the IMSS, and you can get treated free, universal, and everything that we just listed at the beginning. You can get all that. Sounds amazing, because at the end, I pay an annual fee, and if I need let's say a heart surgery, I can get that for free. That sounds amazing, and it actually is. But I'm going to tell you the exceptions. So it's made for insurance and pensioners, children of policyholders, high school and graduate students, workers registered by an individual employer, people that work for an owner. Let's say people that work on the field, people that have a boss. The boss is required to give him IMSS. Or if I don't have anything, any other insurance, I can go in and say, hey, I want to pay my annual fee, and I become one of them. So meaning that whenever you get sick, you can go there. But I put it on capital letters. In Loreto, at least, it provides only ambulatory care, meaning that it is not a hospital, it's a clinic. They don't have the means to treat major problems. They don't have an OR. They don't have a way to hospitalize patients. They don't have a way of treating major care. So what do? They try to stabilize the patient, having them in an ambulance, and send them to Constitucion or even La Paz. That's it. I mean, at the end, it might be free, but who would like to be having, knock on wood, heart attack? And say, hey, we need to hurry up because you need to go to Constitucion. And what if the road is blocked? What if their ambulance just got a flat tire? I mean, it's about minutes that we need to make a decision. So the fact that Loreto only has a clinic makes it very difficult for the doctors to treat patients. The next one.
So the Vienna Star IMSS hospital is not for
No.
the IMSS.
Exactly. They're completely separate. Even though both start with IMSS, it's not the same thing. To be honest, I have no idea what they decided to call that way, but this is completely separate. And that's a very good question because there's been people that they see this logo and they see on the main hospital, oh, this is the same thing. So I go there. Unfortunately, no, it's not the same. So in Loreto, the IMSS Loreto have general physicians. They have clinical laboratory access. They send the patients to another facility. They run the blood work and they send it to the facility. They don't do it there, but at least they have access to do blood work. I do think they have an X-ray machine working at this moment. They have an emergency room to, like I said, stabilize patients, treat minimum or minor things. And they opened a few years ago a hemodialysis area, which is great. But at the end, how many people you know that needs hemodialysis in here? I mean, there's not much. But at the end, I mean, we have it. It's good for the population. But important, like I said, in case of emergencies, the patient has to be taken to another facility outside Loreto to continue with the treatment or to try to stabilize. There is agreement that whenever they have a patient that is a life-threatening situation, they can send that patient to the hospital here in Loreto. So we can stabilize the patient. And as soon as the patient is stabilized, say, hey, okay, he's stable, here you go. Continue with the treatment. But at the end, what do they consider emergencies? That's the problem. Okay? Next one. Now, to talk about the East Loreto. The East Loreto is the one, it's this facility, is the one next to police station. Very similar, the next one, the next slide. It's a very similar scenario to IMSS. It is also a clinic. As you can see, it's a considerably small building that only treats ambulatory care. The next one. East Loreto covers mainly people that work for the government. These ones, you're not allowed to be part of it because this is mainly for people that work for the government. For example, myself, I work for the government hospital. So in case I get sick, I cannot go to my own hospital that I work. I cannot go there. I have to go to East. And they said, hey, I have East. Can you take care of me? Sure. But if I get sick, I cannot go and get treated at the hospital because that's the way it works. Police officers, teachers, everybody that works for the government has this. So, but you cannot go and get there and say, oh, I wanna pay an annual fee. No, this one doesn't have that. And it's mainly for people that work for the government and the people that a patient takes or watches over. The spouse, their kids, grandparents, they all cover. But at the end, This is only for people that work for the government, okay? The procedure of affiliation, they have to go to the delegation personally and get assisted there, okay? Any questions so far? We're good? Okay. So East Loreto, very similar as it is in IMSS. It is only ambulatory care treatment. Okay, they have an emergency room, but they are received by general physicians. And at the end, there's a lot of, I have seen so many general physicians here in Loreto that have, you can imagine, the best expertise ever. They're very, very good doctors. But at the end, you cannot ask a general physician to perform a surgery, to intubate a patient, to put a central line, because at the end, can be very qualified. That's why there is specialists that have to treat every certain patient. Okay, so there's only general physicians. They are nurses. They do have a clinical laboratory on site. They don't have to take patients to another facility. They do have an X-ray machine, and they have an emergency room area. But the same as it is in IMSS, in case of emergencies, the patient has to be taken to another facility outside Loreto to continue with and stabilize the patient. Okay, next one. Now let's go for I would say the most important one, but the one that I work, and I can tell you a lot of things about this one. IMSS Bienestar, it's the hospital on the main entrance. As you can see, it has changed in the last few years. This was a picture taken a few years ago in which it was still called Secretaría de Salud. Now they changed it and it's called IMSS Bienestar. There's still not a picture there, but this is the hospital that was originally built from partial funding from the Loreto Bay community. And is the one on the main entrance, okay? For the people that don't know, I don't think he was able to come. We asked him, but I think he had a meeting. Dr. Oscar Green, he's the director of the hospital. He has been there for the last 2 years. He has done an excellent job. He's not here, but I can assure you that he is doing the best he can to try to improve the quality of the hospital with the resources that we get. Okay, but for the ones who don't know, that's the director. Okay, so who can go join? People that don't have Social Security, meaning people that don't have, well, how many of you have IMSS? I've seen patients that have a little bit that have IMSS. At the end, well, you don't have to raise your hand, but anybody that don't have IMSS and don't have ISTE, but there's the but. There's the exception that have a curved number, meaning anybody that has a permanent or temporary residency are eligible to be treated in here. Okay? The ones that don't can be still treated in here, but it might be a cost. But at the end, they can be treated. If you don't have ISTE, don't have IMSS, and don't have a permanent or temporary residency here, you cannot go to ISTE. You cannot go to IMSS, but you can go to the hospital. And like I said, at the end, there might be a charge, but you can get treated, which at the end is what we're looking for. And to make it even better, you're going to see the difference between ISTE and IMSS, what this hospital has to offer to Loreto. First of all, we do have an emergency room, the same, but we have 5 observation beds. Let's say a patient comes in that requires for us to watch the patient for a few more hours. Maybe not to hospitalize, but to watch the patient for another 2-3 hours to see how he feels. We have 5 observation beds that we can put the patient in comfortable in the bed without having to wait on a chair and see how he feels. Okay, so we have 5 observation beds. We do have a crash unit, meaning that when a patient comes in with a stroke, a heart attack, we have a special area that is surrounded with everything that we need to treat a patient. I'll show you some pictures. I was able to take some pictures and I'll show you. The only one in Loreto that has an operating room. We do have an OR in which we are able to perform multiple surgeries, which I'll explain in a little bit, but we do have an OR. Just today, we had surgery. It was a scheduled surgery, a hernia repair. And on the delivery room, there was a baby born about, I want to say, an hour and a half ago. So there's plenty of work. We do have a clinical laboratory on site on the building. We do have a clinical laboratory, and I'll explain which ones we're able to do. We do have an X-ray machine working at this moment. We don't ever know what's gonna happen, but at least at this moment, it is working. A small one, and it's a portable one. I'll show you. I'll show you pictures. But at the end, I don't know. I'm pretty sure many of you have done X-rays at the hospital. There's times that they have asked for an X-ray, and the machine is broken, and it might take days, weeks. There's a time that it took months to be repaired. So that's when we get to struggle. But we do have an X-ray machine at this moment. Okay. We got 2 EKG machines. One of them was just recently donated by one of my patients. I'm not gonna say names because I want to be anonymous. But we do have 2 EKGs machines right now, and we have 12 hospital beds for patients to be hospitalized, and where patients can spend the night, 1 night, 2 nights, 3 nights, as many nights as they need. We have 12 hospital beds right now. I left the hospital, like I said, a few hours ago, and we were at probably like 60% capacity occupied. There's always, I'm not gonna say there's every time the 12 hospitals beds free, but normally we try to have 1 or 2 beds available in case of an emergency. But at the end, there has been times, the end of that last year, it was 99% occupation. I mean, we get times that it's completely full. We have 4 ventilators for patients that need to be intubated. We have ventilators. Okay. We have infusion pumps. There's times that the patient right away needs to start on medication to help with the pump of the heart. We have infusion pumps, and we have monitors to keep the patient under every protocol that is required. So it provides the most complete medical care and the only public hospital in Loreto. For Loreto, I'm not gonna say it's the best hospital and it's better than Salvatierra or the ones that, or Mayo Clinic or things like that. But I can assure you, and not because I work there, I promise. If there was another one, I would say it. But this one is the only one that has a hospital. The other ones are clinics for emergencies. Okay. So the next one. Now we're talking about public hospitals again. Okay. And remember, we said at the beginning, public and private. They're different things, but at least for a public hospital, it's a great thing. Okay. So we also have a staff. As you can imagine, or as you can see, the other 2 clinics, we put just general physicians. That's it. In here, we have specialists. We have 1 orthopedic surgeon. Many of already know. He has actually done multiple surgeries on patients in here. His name is Dr. Casillas. Okay. There's 2 pediatricians. There's 1 OBGYN, my lovely wife, Dr. Carmen. At this moment, there's 2 general surgeons, including myself and another doctor. 3 medical internists. 3 anesthesiologists. 1 emergency doctor. 15 general physicians. 15. And 47 nurses. It sounds amazing, doesn't it? But it's not. Why? Because all this, they're distributed all around the week. We don't have all this daily. We don't have this right now. Like, for example, 3 anesthesiologists. There's 1 for the morning, 1 for the evening, and 1 for the weekend. So meaning the anesthesiologist by itself all the time. Emergency doctor only comes on the weekends. Pediatricians, 1 in the morning, 1 in the afternoon. There's no at the weekends. Orthopedic surgeon. Well, he tries, but normally works in the mornings, and we're on call. Myself, my wife, and Dr. Casillas, we're on call 24/7. Well, 24/7 when we can. But normally we are on call in case of an emergency, if it's in the evening, nights, we are on call, okay? The general physicians, 15, but imagine to fulfill the necessities of mornings, afternoons, nights, there's always one doctor, at least. Even if it's 2 o'clock in the morning, there's always gonna be one doctor. But imagine having one doctor with 10 patients hospitalized, with 2 pediatrics, with 3 emergencies, one doctor. So again, this sounds amazing. It is great if you compare it to the clinic in East or the clinic in East. But these are the main problems that we get. Okay, we have a pharmacy. Wow, we have a pharmacy. How many of you have to be hospitalized at the hospital? And we have said, hey, can you go to the pharmacy and buy these medications because we don't have any here? Okay, sure, what it is. It's Tylenol. Wow, you don't have Tylenol? That's the problem. And we do have an X-ray technician. Okay. The next one. So I'm going to explain each area of the hospital. Emergency room. The most common situations in emergency room are the most common things that we treat in here. It's metabolic problems, diabetes, blood pressure. That's the most important thing. We get to treat on a daily basis 5 patients that come in with a high blood sugar, blood pressure over skyrocket. So that's the most common thing that we get to see. Pregnant women, like I said, yesterday there was 1. I think yesterday there were 2. I mean, they just keep on coming. Food poisoning actually is a very common, especially for foreigners. People are just here vacationing. People are here just visiting. They think they're Superman and they can eat whatever. And even though food in Loreto it's amazing, they don't have our
Iron stuff.
immune system as we do. So they get sick. So we get a lot of food poisonings. We got a lot of trauma, as you've heard. There's multiple sometimes accidents. There's multiple. When I came here, they said Loreto is a very calm town. I mean, it is lovely. It is peaceful. A week later, I had 2 car accidents. I had a 1 shot. I'm like, that's not peaceful. But at the end, that's things that patients do not hear. We get to deal with it, but at the end, it's everywhere. I'm not saying that Loreto is not a safe place. It is much safer than other ones. There's always gonna be car accidents. There's gonna be people getting into trouble and things like that. So we get a lot of trauma, a lot. Okay, heart problems. Sure.
Snake bite. You treat snake bites?
We do, although most of the times we do not have the we don't have that. But the good thing is that snake bites and scorpions, that we call it, scorpions bites, most of them they're not even dangerous in here. So it's just a matter of watching the area that got bitten, antibiotics. So that's at least a good thing. They're not poisonous, I would say. Okay?
Would you suggest you just went to Constitution or?
No. Because again, in Constitution, it might be that they don't even have it. This is a problem not only for Loreto, this is a problem for the whole government facilities. What I'm gonna tell you at the end as a conclusion, which is lack of a lot of things, is not something that only Loreto is struggling with. It's everywhere. Okay?
But in the ER, they would suck the venom out with the suffering thing.
In some cases, yeah.
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 You can't want to do that fast.
Heart problems, anginas, heart attacks, or just chest pains. Surgical ones, lots of hernias. Like I said, we did one this morning. Appendicitis, the most common emergency surgery. Many of you have suffered that in the last few years. Gallbladder surgery, that's the one that I do the most on schedule. I do an estimate of 1 or 2 a week. Gallbladder removals. It is amazing. That's the surgery that when I came here, people were making fun of like, hey, I think you're getting rid of all the gallbladders in Loreto. Like, I don't think so. every time we go in, I go into appointments, I get a couple more patients that I have a gallbladder problem. I have done surgeries. I don't know if there's any of you gallbladder surgeries in La Paz. Sometimes a patient says, hey, I want the best surgery, doctor. I have gallbladder stones. Okay, the best surgery is to do it laparoscopically. And unfortunately, we don't have a laparoscopic tower in here. We can do it open. I mean, I have a small hand, but at the end, at the end, it has to be an open surgery. So when a patient says, hey, no, can you do it laparoscopically? Because I heard it hurts the least. I can go back to my normal life quicker, pain. Yeah, sure. Go to La Paz. Can you go? Sure, I go. I don't have a problem. But at the end,
And a laparoscopic tower costs what, 30,000 US?
depends. If we want a new one, you want a recent one. To be honest, a used one average would be about like 600,000 pesos. I don't know how to convert it.
30,000.
Yeah. So, okay. But again, we have talked about that possibility in the past. They're like, hey, the problem is the government. If we get that machine, the government say, hey, Constitution needs one. Thank you. So we have always tried to say, hey, if we get something, it's for us, for Loreto community, because they are the ones that gave it away. For example, the EKG, there was one time they needed it in Santa Rosalia. And they said, no, it stays in Loreto because they donated it. So you cannot take it. The same with an ambulance. One time they got away and they took it from Santa Rosalia, but they said, hey, it is ours. You need to bring it back. We're trying to help. I mean, it's not that we don't care about other facilities. We receive a lot of patients from Santa Rosalia actually, because at the end, if they don't have we suffer a lot with my wife, OBG. We have an OBGYN and the patient is dealing with this situation. Can you help? Sure, bring her over. Is the one, my wife, that's one is gonna be in trouble, but I mean, at the end, we try to help the community so much, but that doesn't mean they're gonna take advantage of us. And that's one of the main issues that we always worry. Strokes, not as common as you would think, but still it is a common thing. And I'll explain what we do with strokes in a little bit. Okay, any questions so far?
Makes you, then it can stay here. Is that correct?
We make even paperwork to try to make it happen. But at the end, you never know.
I think, isn't
But-
it true that government has the right to move the equipment where it wants, no matter who donates it? Isn't that the bottom line?
Yeah.
But I have to add to that, we've looked into it legally, and if we don't give it to them, we can loan it to them and they don't own it. And that's what we need to do.
Exactly. Okay, so this is pictures of the hospital inside. Normally this is crowded. I took the pictures middle of the night. But that's the emergency room. We have, like I said, 5 hospital beds. They have a curtain. But at the end, it's one big room in which if the patient has for a patient, there's 4 in here, and there's another one right on the side. Okay. Okay, that's the trauma unit. That's where I was talking about. Many of you have been minutes in here, hopefully, but this is where we treat patients that come in with a possible stroke, with a possible heart attack. And as you can see, we have monitor, we have an infusion pump. This is for like shocking the patient. Defibrillator. We it used to be called a red
Code, red.
code. Now it's a blue. We have an big oxygen tank, and this is a portable oxygen tank. I mean, enough and it's always there. Working, no working, it's always there. But it's always there. Okay, this is the X-ray machine that we were talking about. This is where we do the X-rays, but this is a portable X-ray machine. So this can move, and it can go to the OR. When the orthopedic is doing surgeries, they can actually take that and do the X-ray at the OR and come back. But it's the only one. So you can imagine how many X-rays they do a day. I was asking the guy, the technician, and he said an estimate of 14, 16 a day. I mean, that's on a normal, regular day. If it's a big accident, you can imagine. So it's understandable if there's a time that it needs to be repaired. But repair means not working. What do you do when you have a patient that just twists their ankle, you want to rule out that it's not broken? So that's one of the main problems that we have. But that's the trauma unit and the X-ray portable.
Dr. Salinas?
Mhm.
So if I didn't have coverage and I went in and I needed an X-ray, so I had to pay myself.
Yeah.
How much would it cost me?
That's a very good question. Depends on what the patient, they do to the patient. But like say, just a plain X-ray, I think is rounded around 600 pesos,
600 pesos.
600 pesos,
$30.
so about $30,
Wow.
just the X-ray. But I mean, I would say it's nothing
Yeah.
compared to, not gonna say the name right now, compared to other facilities in Loreto. I don't know if you heard. There's other places that you can get X-ray, sure, privately, yeah. There was a patient that said, hey, yeah, I got a chest X-ray for 2,000 pesos. They did 3. Wow. So, but yeah, normally when a patient comes in and they need an X-ray, it's just not gonna be the X-ray. It's gonna be the doctor's appointment, probably a few medications to calm or ease the pain, or a cast. So it depends on what they do, and the patient needs to be charged because they don't have a card number, is what they charge. Okay? Before one at a time. This is the hospital beds at the hospitalization area. It's 2 per room, 5 rooms, so 10 total. And then we have 2 other ones that are privately for people that need to be isolated, pneumonia, things like that. Okay, immunocompromised. But normally there's 2 beds per room, and each room has a bathroom. I mean, it's better than nothing, but who would like to be obviously butt naked and then there's no patient and so I mean, but again, East Loreto doesn't have that. Okay, the next one. This is the pediatric area. We have a really nice pediatric area actually. People that are born that need to be incubated. We have the facilities, and like I said, the 2 pediatricians are outstanding. The next one.
Dr. Salinas?
Mhm.
When you go, is it cash only? Like, do
The
it
hospital,
used to be cash only?
many years ago, but
Yeah.
now the thing is, it's a very good question because they do have a terminal. But the problem with terminals is connection. Connection. It's mainly about bad connection. But they do have a terminal in which a patient can be paid with a credit card. Yeah, not a problem.
Okay.
And this is look, this is a pediatric area. So this is a big room that is able to hospitalize 3 patients. There's one crib. It's a crib in here, and 2 more beds, and another isolated. So 4 total. Okay, but this is the pediatric area. Okay, lab, very important. At the hospital, we're able to do a lot of things. A CBC, metabolic panel, comprehensive metabolic panel for like liver function, liver enzymes, pancreas, electrolytes, urine analysis, stool sample, cardiac enzymes. We're able to do cardiac enzymes. So when a patient has the diagnosis of possible heart attack or possible angina, we're able to do cardiac enzymes. And there's other studies that we can do in Loreto, but they have to be sent to La Paz. So it might take a few days to get the results. But things like thyroid function, like a biopsy that I do in the middle of the surgery that I think it might be cancer, we can do that, but it has to be sent to La Paz. Okay. This again, I'm sorry to be repetitive, but again, it sounds great, doesn't it? But the technician or the chemist, there's one in the morning, there's 2 in the morning, there's one in the afternoon, there's none at night. So we always said, do not get a heart attack in the middle of the night. That's one of the main reasons. I mean, we can stabilize you But if we don't know that your cardiac enzymes are increasing, what do we do? So again, getting sick at night, it's not fun. And for some reason, is what happens the most, so. But okay, the next one. No, that's a very good question, and we were gonna talk about that in a little bit, but I'm gonna explain a little bit right now. Again, this is a public building, meaning that you cannot go in and say, hey, I just wanna get my blood work done. Because normally, it's not gonna have a cost unless the people that are not requiring, but at the end, being a government facility, everything that is non-emergency needs to be treated as the rest of the population that have this. Meaning, oh, I just want to get treated because I want to get treated here. Okay, so you go in and ask for a number. Anybody that your number is number 14. So you need to wait 14 patients before you get to be seen. If you go into the emergency room, oh yeah, I have a problem. I just twisted my ankle and I think I broke it. Okay, but there's a patient in front of you that has a heart attack. There's a patient in front of you that have a stroke. There's a patient right in front of you that has a big wound that needs to be repaired. So you're gonna wait a little bit. That's the problem we get public services. Again, as the rest, as we probably suffer everywhere around the globe. Waiting. Sometimes waiting for us is the most important thing. We don't want to wait. Nobody wants to wait. But at the end, when we have 4 or 5 patients in front of me, how do I say, hey, I want to be in front of the line? If it is required, you will be in front of the line. But who gets to decide that? The doctors.
Dr. Salinas, so if you are permanent
Mhm.
and you do need blood work, do you go to the hospital that day and just kind of take a number?
For example, very good question. If it's not an emergency, let's say I want to get blood work done because it's been a while since I've done it. I suffer from blood pressure, diabetes, but right now I'm okay. So you go in and get a ticket. You go and see your primary physician. So again, you wait. Oh, your number, let's say 3, because you got there at 6 o'clock in the morning. And you're number 3. Okay, so you wait. You see the doctor. And if you don't have any problem communicating, because that's another issue, but if you're able to understand and all that, you get a piece of paper for blood work. That piece of paper, you take it in and say, hey, I need to do this. Okay, your blood work is going to be done in 2 weeks. Okay, I'll wait. So you come in 2 weeks, you get the blood work. What do I do with that? Oh, you're gonna go and see your primary physician again. Okay, then you go again. Oh, you're number 13 now. Okay, I'll wait. That's the problem. That's what all the population, most of the locals, Mexicans, get to deal with on a daily basis.
So in that scenario,
Mhm.
if I go to you, my primary physician, and you say, let's get a blood test,
Mhm.
but it's not a huge emergency that you want me to get it. I still go back and they might still say 2 weeks.
Yeah. And I'm gonna put it as what you do in we don't want to wait. There's things that we can do. But yeah, we do have a lab. That's the lab that we have. In that lab, like I said, we're able to do all those different things that we just listed. The other one. We do have areas in which this is all full with blood. We do have blood bags. I would encourage, I know a lot of you have tried in the past to donate. There's certain specifications to be able to donate. Unfortunately, they're very, very specific on who people can donate and who can't. But I would recommend, or I would ask, to spread the word. We are able to get people, if they're eligible, to drone some blood. They have to send it to La Paz to process, but they take it, they bring it back. So you can see how there's 1 in here, there's 2 in here, empty, empty, empty. I mean, we are normally not really out of it, but we only get to deal with this on a daily basis.
Can you,
Requirements on a general basis is that you are not over 60 that you don't have any. I didn't want to say that. That's why they say requirement, but that one will make issue. I don't know if, and many of you heard, there was a time that a fellow, friend from many of you require, multiple units. A lot of people came into the hospital willing to donate because he was negative. He was on the blood type negative. Like, hey, I'll donate, I'll donate. And the patients were negative, like, hey, we need your blood. Sorry, well, you can't. And there was a lot of patients that said, hey, why can you be so close-minded? It's not me. It's not Dr. Green, which is the director. It's the government. They don't authorize it. We need to be obviously very specific on the information that we put on the system. And as soon as we put over 60, they'll say not eligible. So unfortunately, yeah, that's one of the main issues.
So
And
we
there's
should
other
lie
ones.
about our age? We should lie about our age?
Well, unfortunately, they do ask for an ID and things like that, but yeah, I would recommend you. Okay, next one. Okay, OR. Like I said, we're able to do a lot of I wasn't able to close that, but we're able to do a lot of surgeries. This is the doctor that it's another surgeon. As many of you, there's a lot of Cuban doctors nowadays. Of the list that I mentioned a few slides before, they're included. Actually, the 3 internists that we have in Loreto now, they're all Cubans. One surgeon is the one in the afternoon, is from Cuba. Anesthesiologists, 2 are from Cuba. I mean, we're getting a lot of help. But at the end, we're still limited in personnel. This is Dr. Green, and that's Dr. Casillas. They're performing a surgery for trauma. Again, my main focus, myself, I'm a general surgeon, but I focus on gastrointestinal issues, although I think that one was an amputation. But in this one, they're doing a fracture. Okay?
Do you have an ultrasound machine at the hospital?
That's a very good question. We do have an ultrasound machine, but we don't have a radiologist. So it's right in the corner, waiting for somebody to be used. And you would say, oh,
Read ultrasound as well.
that's the thing. I read ultrasounds, I don't do them. It would be very irresponsible of myself to do an ultrasound when I'm not,
Okay, so no tech.
okay? But that's a very good question because we're waiting for somebody. And I have a really, really, really good colleague of mine, Dr. Angel Navarrete. He used to be a doctor here. He went to be specializing in radiology, and he's finishing his course next year. So hopefully he'll be joining us soon. But that's the most common surgeries they do. My lovely wife, watching after his lovely husband, she's doing a C-section. That's what the surgery she does the most, although she does other ones for female patients. Okay. That's the OR. It's only one OR. But as you can see, I mean, it's big enough for us to do the surgery. This is the recovery room. Yeah, the beds, look at that. I mean, I was gonna say, hey, put a blanket inside. Like, I don't know. I wanted people to see sometimes what we get to struggle with. But I mean, putting a blanket, it's not bad at all. But that's the OR, and this is the recovery area. And again, we have a defibrillator everywhere in case needed. Okay, next one. Now, very good. We have come to the very important slide. We get to treat a lot of things, but we're not gods. We won't be able to treat everything, to be honest. So what do we do when a patient is stable, but still needs to be treated? We have an evacuation emergencies or code. Depends on the patient. If it's very, very sick and needs to be treated ASAP, we get into an ambulance. This is an ambulance from the hospital and ground transportation to Constitución, to a public facility because we're a public hospital. So we take them to a public facility in Constitución. When the patient says, okay, yeah, he's very sick, but in Constitución, they're not going to be able. Constitución and Loreto, to be honest, it's very similar in what we are able to offer. but it's just more personnel, bigger hospital, more staff. So sometimes if we don't have the enough personnel, la situación will, but at the end, for example, a stroke, La Paz. Specifically, Salvatierra Hospital. That's the name of the hospital that the patient is taken to La Paz on a public institution. Okay? Or, as you can see all the way on the back, we have a very good colleague that decided to come along. It's a very good friend that I met since the moment that I arrived, Osvaldo Aguilera. He has worked with us as a unison to airback patients to United States, to San Diego. Many of you have actually done that in the past, but we have done an excellent team so far to try to work for the patient's line. So feel free to answer any questions with him when we're done. He has a stand over there in case people have questions. Mhm.
Do you have CPA drugs that they use immediately when someone has a stroke within the first?
We do one. So we use it. Unfortunately, that medication, the TPA, it is about a 30,000 pesos medication. So it's not like, oh, here you go, you have 5. Sometimes I deal with not having sutures. So obviously that medication, we use it, and it might be that we don't have it for another 2-3 months. Sure. Sure, at the end, yeah. Okay,
So there are different airback companies. Which one is this?
this is Aero Medevac.
Air Medevac.
Yeah, there's different ones. I'm not gonna say he's the only one that we work with. We have worked with so many other companies. So it's mainly about you guys' decision. I just decided to say him because as you can see, he was the one that called me and said, hey, Dr. Salinas, I heard you having a small talk. Can we come along? Sure. I mean, at the end, he tells me something.
Where is that aircraft parked?
It's not here. When a patient requires airback evacuation, we coordinate and they bring an aircraft for the patient. And as soon as it arrives, we send the patient with an ambulance to the airport, goes straight to the airport and leaves.
Dr. Salinas, with all of the different medevac companies, there has to be a coordinating doctor, and my understanding is the patient with the policy still has to call a doctor. The doctor has to do the work, and it used to be Dr. Fernando.
Exactly. Lovely doctor. I have changed. I have fulfilled or tried to fulfill his shoes. So every time you need something, you're still gonna be calling me first, and I'll make all the arrangements to get you where you want to go. It doesn't matter. It doesn't matter. For me, it's about you, not about companies. It's about you. Yeah.
I can vouch that, we had a medical evacuation via SkyMed from Loreto Bay. Can't give you any more information than that, but the doctor saying is that reached out to me and the process started, so.
SkyMed, exactly.
Does work with everybody.
Exactly. SkyMed has also been a great example. And at the end, like I said, it's all about you guys. I don't care who comes to pick you up. It's about your life. If it cannot be treated in here and it can be flown, we'll do it. Okay?
The public private hospital.
Yes. Yeah, we're gonna talk in a few slides. But yeah, that's keep this in mind. This is from the hospital to a public facility. Okay? No. That's a very good question. Normally the airport closes at a certain time. They're not allowed to come in at like 2, 3 o'clock in the morning. So what do? We keep the patient hospitalized to make sure it's stable enough. If the patient is not stable enough, we're not gonna wait for an airback evacuation. I'm not gonna wait, especially.
My wife got airback MedJet assist 2 years ago, and they were at the airport that night.
Sorry to hear that.
But before midnight, and she had to be hospitalized, had to have a doc on this end, a doc on the receiving end,
Exactly.
and on the receiving end.
Mhm.
And they actually flew us to Seattle. They worked amazingly well.
Yeah, exactly. Yeah, but exactly. I mean, we're not gonna consider an evacuation on a patient that is not stable. If he's not stable, we'll treat it or stabilize it and make the decision of you need attention right away. Mhm. Well, the first thing we do is receive the patient vitals. We do an EKG, like I said, because we do have EKG. We have liver enzymes, but in that kind of cases, we take them to La Paz directly to consider do an echo, to do an catheterization, and all that. We're not able to. Yeah. Yep. In Salvatierra Hospital, yeah. Over there, yeah. In here, we struggle a lot with medications. When we have, like we were saying about the TBI, when we have it, we'll do it. The problem is having it. But yeah, that's the protocol now. With that or with a stroke, it's a CT right away. So that's what we're focused. So again, this is the main three things that we do in case of evacuation emergencies, okay? The next one. So this is great pictures about the ones that you did a couple of months ago for and you can see how there's an ambulance from Loreto taking the patient all the way to the airport, to the airplane. I mean, they don't have to. Oh, now you're gonna wait on costumes and so they go straight. So we don't need to worry, and the paramedics will go in and they take them. Okay, but a very important question, a very good question that somebody just asked. Okay, what if I want to be treated in a private hospital? Can you take me there? Let's say I have heard that Paz Hospital in La Paz, it's a great hospital. Sure, it is. We're not authorized to take you on one of our ambulances to a private hospital in La Paz. We're not allowed because at the end, we're using personnel, we're using gas money, we're using a lot of things to take a patient to another facility. If we decide to take them, we have to take them to Constitución or La Paz to our own facilities. If a patient says, yeah, doctor, but they're taking forever, forever is what we're trying to avoid. So what do? Lack of ambulance is sometimes the things that we struggle a lot. There was one patient, again, I'm not going to say names, exactly a week ago. I think it was like Wednesday. She was hospitalized and she had a unstable angina. She came in complaining about chest pains. Put her into the hospital, did a lot of things, did an EKG, showing there was not a heart attack, but it was unstable. It can lead into a heart attack if it was not treated or studied more. So we said, okay, we can either wait for the next EKG in a couple of hours and see. She's like, no, I don't want to wait. Yeah, but the problem is that Salvatierra is not accepting it right now because you don't have what it takes to be treated as an emergency. Doctor, for me, it is an emergency, for sure. Again, that's what a lot of things that I get to deal with. I know for you guys, a lot of things are emergencies, and for me are too. If you consider an emergency, I'll consider an emergency because I want to have a peace of mind for you guys. But that doesn't mean that the hospital or the government is going to say, sure, it's Dr. Salinas, then come on over, bring it. Unfortunately, it's not. So what did the patient decided? It's terrible to say it, and I wish I didn't have to say it. She's like, okay, can you put my IV out? Okay, sure. Hop into her car with her husband, drove to La Paz, and like, okay, where do I go, doctor? I'll give you all the things that you're gonna do to get that treatment.
Dr. Salinas,
Mm-hmm.
used to have the Red Cross ambulance. We don't have that anymore?
No, they're working on it. Unfortunately, they are working on it to try to open it again. But unfortunately, we don't know if it's gonna be something in a week, a month, a year.
And is this something the community can support then?
We and again, I don't want to say more than I should. We're working on a major project with Aeromedevac about donating an ambulance.
I had a friend that had a very serious accident, went to Constitution, and they didn't think they could treat her. And then they did from Constitution take her to the private hospital.
Yeah.
I don't know what.
Because in Constitution, they have a few private ambulances.
Oh, okay.
I mean, like in here, what happens if I want to be sent to, let's say, Fide Paz Hospital? The first thing we're gonna do is try to call bomberos, paramedics. Hey, do you have an ambulance available? Sure. Can you take a patient of mine? When? Right now? Okay, sure. We'll do it. They're gonna charge, but they will take you to a private facility. I'm not gonna say we don't have an option. The problem is when we call them like, oh, sorry, doctor, but that ambulance is taken right now. It's been used. You have another one? No. It's mainly about the doctor. In La Paz, there's multiple private doctors that can do. Depends, to be honest, in that case, we would lead it to the cardiologist. Yeah. I wouldn't know exactly which ones, but there's multiple. What I do, let's say I have a patient of mine that has a cardiac, for example, this patient, like I said, the one that had a problem a week ago. I call it a friend of mine. Most of you have heard of him or even treated, Dr. Oscar Prado. Dr. Prado. He's an internist, but he has his own clinic in La Paz. So I call him and said, hey, I have a patient with this background. Send her in. I'll do an echo, I'll do a Holter, and if it's needed, I'll arrange it to do a catheterization tonight. Okay. I wouldn't know. To be honest, it's a very good question, but this is for like, I send the patients to the people that know where. No, I wouldn't know.
I understand we all have a right to healthcare, acute emergencies. I do feel with the limited resources in Loreto, doesn't it? The limited resources that you have in Loreto, does it not affect the Mexican people that live in Loreto? Are we taking away those resources from all those people? That's the first question. The second is I want to know what's out at the airport. There's some kind of.
That's a very close. Okay, so the first one I can assure you that you're not taking it. At the end, it's your life also, and it matters. For me, matters. Doesn't matter if you're Mexican, if you're Canadian, if you're American, if you come from Australia just for a week. For me, it matters. And I can assure you that the government feels the same. That's why they included in the past. They said all Americans that come into the hospital, I don't care who they are, they have to pay. Now they said, okay, the ones that have curb don't have to. But no, I can assure you that you're not taking any Mexicans treatment over them. So no, that's a very good question, but no, do not feel bad about getting treated at the hospital. Many of you have been treated surgically or medications are hospitalized. And at the end, you deserve it. Okay. And the other question, it's not a secret. There's a private clinic called St. Luke's. It's like a piece of the St. Luke's facility. It is a private facility, but it's mainly focused on airbag evacuation. They're not there to stabilize. They say they do, but at the end, again, I don't work for them, but I'm going to tell you about my experience. We have had patients that come from there to our hospital saying, hey, can you stabilize my patient? Because I want to fly them. Okay, sure, we'll do it. That's not the way you do it. You have to send her to our facility first if you don't feel capable. So at the end, they're more focused on sending the patient airbag to Cabo. To their facility.
Can I add something to that? You might all know there was a State Department message about that facility in Cabo where they said U.S. citizens have reported instances of withholding care for payment, failing to provide itemized lists of charges, ordering unnecessary procedures, withholding U.S. passports, obstructing medical evacuations and refusing to discharge patients without payments at the St. Luke's facility. And we happened to meet a doctor in Cabo when we were there who used to work for them and said, I had to leave ethically. They wanted to perform procedures on pregnant women that we shouldn't do. And they wanted us to catheterize someone who had died so they could charge for the urinary analyses.
And again, it's not a secret. I don't know if you've heard people that have been treated there. And at the end, exactly the same day that I told you about this lady that went to La Paz, there was another patient. He even posted some things on Facebook saying, hey, I need help. I went there to help. At the end, sometimes, or there's a lot of times that I only help even to stabilize and treat you mainly on the communication. But I'm not the treating doctor. That patient had a pneumonia and had to be treated by the internist. They said, hey, you're not good. You're sick. You need attention because you got other backgrounds. Okay. They said I'm not good. Yeah, your life is at risk in here. Okay, I don't like that. So I'm gonna go somewhere else. Okay. They call me, and before I can even do anything to try to send them somewhere to the States, they say, oh no, somebody called us already from St. Luke's, and we're gonna be flown to Cabo. And then from Cabo to Oregon. I'm like, why don't you just fly from here to go to Oregon? I don't know. That's what they said I need to do. Okay, at the end, I gave the patient all the information. Said, thank you, doctor, but I'll go to Cabo. I didn't know what happened. At the end, I'm just here to help. I don't care what you decide. You're not in prison when I tell them they're in the hospital. You can decide if you want to get that surgery with me, if you want to go back to the States, if you want to get treated in La Paz. At the end, my job is to give you all the information necessary like this. So at the end, you can decide. And I'll help you with that decision. Even if it's not what I think it's best for you, if it's your decision, I'll do it. And again, we'll go a little bit faster because we're right on time. Okay, so the conclusion, major medical issues in Loreto. This is the truth. Most of the times, doctors have to deal with the lack of a lot of supplies, routine supplies. Okay, the end of the year, we didn't have any IVs. Any. So they're like, okay, I have 2 surgeries scheduled. Are they emergencies? No, you're not gonna have to do it in a couple of weeks. Okay. Limited personnel, like I said. We have a lot of personnel, but they're divided. And I try not to, but I'm gonna also be honest. All doctors are allowed to have vacations. I've never gone anywhere. I'm always here. But at the end, what happens if, for example, in March, I'm going to Mexico City with my wife because there's a I know, just you won't even notice it. You won't even notice it. Plus, we're going to a small congress to get machines that my wife needs for her business and all that. But we're gonna go for a few days. What happens if I'm not there? So we always have to struggle. In my case, you don't have to suffer because I do have my backups. But at the end, what if the internists are gone? And I have a patient with a heart attack. Hey, there's no internist. I cannot treat a heart attack. I can assure you. Give me an appendix and I'll do it with my eyes closed, but I cannot do a heart attack. So lack of number of specialists, lack of medicine and limited pharmacy availability. How many of you have gone to a pharmacy in town and they said, hey, can I get this? No.
Yeah.
Do you have it? No. Can I get it? Sure. It'll take you a couple of weeks. Oh, that's one of the main problems we get. But it's everywhere. Now, don't think it's just Loreto. Lack of imaging equipment. They were saying, hey, you have ultrasound. We do have ultrasound. We don't have a radiologist. There's only one radiologist in town. Many of you know him, Dr. Franco. He only works in the mornings. He don't do any emergencies. He don't work in the evenings. So if you don't reach it before 3, we're done for the next day. Okay? And like we were talking challenges in transportation patients to La Paz when needed. Sometimes that's one of the main problems we get. So this is the major medical issues we get to struggle on a daily basis. We deal with it, yeah, we have learned how to deal with them, sure. It's not okay though, but. Okay, so now, that was a public, really quick, private. Is for anyone that can afford economically to be treated. Hey, I have ISSSTE, or I have IMSS Bienestar. But you just said that the waiting, it's about 2-3 months. How about if I do it tomorrow? Sure. How many of you coming in from the States, they have done so many things in here in a week that it would take months in Canada or in the States. That's the beauty about private sector. And did you know that Mexico has a greater number of private hospitals than public ones? They have much more. So if it is an obligation of the state to provide health, why are there fewer public hospitals than private? Because unfortunately, the government doesn't have what it takes. They cannot build another hospital. They cannot hire more staff. At the hospital, we need more specialists. But there's not a contract. I have asked and begged the director since I started here, hey, give me another job on the weekends. You're crazy. You're gonna work 24/7. Yeah, I don't care. Okay, we're gonna tell the governor. They said, no, we don't have a contract for him. So I cannot work on the weekends for them. I will if it takes. Or I have for my patients on the weekends, sure. But at the end, the government doesn't have what it takes to fulfill the necessity everywhere. So that's why there's sometimes investors or people that said, hey, we're gonna build a private hospital. And we have heard in the last few years or months, there's people that have thought about building a hospital in town. One of them, St. Luke's, I'm not gonna lie. They're thinking about it. Yeah, wouldn't be a bad idea. Probably not. But at the end, it's not building a hospital. It's who's gonna work there. Okay? The next one. So like again, who are the beneficiaries of the private sector? Anyone that is able to pay. Or those who have insurance. There's hospitals that have a way of working with the insurance companies. I have an insurance sector. So can I be treated here? Yeah, you're gonna pay just a small income, but yeah, you can be treated. Or those that that belong to a public sector, let's say for me. I'm a doctor, but I work for a government facility, I have ISSSTE. But if I ever get appendicitis, I'm probably gonna have a colleague of mine say, hey, I'm going to La Paz, can you do that surgery for me in a private hospital? Sure, I'm still gonna have to pay, even if I'm a doctor, but I know I'm gonna get treated as soon as I get there, okay? Next one. So what do we have as a private facility in Loreto? We have medical private offices, meaning the offices in which you go and see a doctor. For many of you that have seen me, this is where I have my office, MedLab. So if you don't know where it is, I would recommend you look for it because you can find me there. But there's a lot of other doctors, very capable and very trustworthy doctors that have their own facility. They have the walk-in clinic. They have well, there's like 2-3 other doctors that have their own facility that see patients on a regular basis. But at the end, it's a private facility in which you go whenever you want. You don't have to wait to be the number 13, and you get treated right away. Okay? There is clinical labs in which you can do the blood work, like we said, whenever you want. Oh, I want to get done my blood work tomorrow. Sure, you just show in at any lab, and they'll do it for you.
But you need a recognition from the.
Not really. As long as you know what you want to do, you can just go to the lab. Oh, I normally get tested for my A1C. Okay, sure. As long as you go and pay, they'll do it. Okay. But there's MedLab, which, like I said, many of you know. Nunez, it's across the street from police station. Sadat, it's on the main road. And Milab, it's on Juarez Street. And another thing, ultrasound, Dr. Franco. Many of you know him, but if you don't, it would be great if you just start Googling where you can find him, because you never know when might you need him, and he's the only one in town. So I get a lot of patients that don't know where Dr. Franco's office is. He's on Misioneros Street. Okay, but the most important thing, there are no clinics, and for sure there's no hospitals, private hospitals. There's none. Okay. That's the one that I recommend. I mean, and a lot of things that they ask me, it's not to obviously talk about that per se. Whenever you're my patient and you do the lab somewhere, a lot of that labs send the information also to the doctor. That's one of the facilities, because I don't own it or anything, but I rent that place. And then whenever they see a prescription on my behalf, they say, oh, it's Dr. Salinas. So we send the information to the patient and to Dr. Salinas. Okay. So this is a very important slide that I wanted to conclude. On a few occasions, we have to transfer patients out of Loreto who are sent to private medical units. Pide Paz Medical Center. I put another example, Dr. Prada's clinic. But that's a few examples. I mean, we can, I have done, like, for example, myself, when a patient needs me and wants me to be the surgeon, I can do the surgery in Pide Paz, but I can also do it on another one called Nuestra Señora de Guadalupe, or the another one that are the nuns, Maria Luisa de la Peña. At the end, it's private facilities. The patient decides where to do it. I will the one doing the surgery, so I don't have a problem if the patient wants to do it at a 5-star hospital, a 3-star hospital, or a half of a star hospital. I don't have a problem. At the end, I'm going to do this doing the same surgery wherever the patient wants. It's about private. Okay. Other times we have to send patients for studies that we do not have in Loreto. For example, a CT scan. How many of you have had require a CT and said, oh, I want to get a CT scan? There's none in Loreto. So they have to go either to Constitucion or La Paz. Okay. MRI, only in La Paz. There's no in Constitucion. Ultrasounds, there might be times that Dr. Franco is out of town. You're not able to do it. Okay. Or the main issue, evaluated by other specialists, doctors that are not available in Loreto. How many of you have needed an ENT, a dermatologist, a cardiologist, a rheumatologist? There are none. That's what I struggle with a lot. A lot of people said, hey, I'm going to go and see you. Please, let it not be something that is neurological. Because at the end, I'm not a neurosurgeon. I'm not you know what I mean? So I help them and I explain them. I even book an appointment for them to see the doctor that they need. But sometimes, or most of the times, it's in La Paz. Okay? So the city of La Paz has multiple diagnostic centers to provide comprehensive management to their patients. Ciudad Constitución has, I think, 2 that provides at least a private facility. Even to the north, there's places as far as Guerrero Negro. Guerrero Negro has, and there was a doctor that wanted to come from Guerrero Negro for this meeting. I don't think she was able to come. But she has a unit called UDIP as a diagnostic center. So even in Guerrero Negro, they're able to have a diagnostic center. Why don't we? I don't know. The next one. So this is a very quick example of the private facilities that people can reach to. Pide Paz Medical Center. This is the one that I told you on Guerrero Negro, UDIP. But at the end, who is able to go from here to Guerrero Negro? None. I'd rather go to La Paz probably, but this is this is in Constitucion to do CT scans. So this is what we're gonna conclude the today's talk. The struggle that we have to treat patients sometimes.
Sometimes you bring specialists up on a regular basis. Can you talk about that a little bit?
Actually, that's my finishing line. The next one slide.
Okay.
What could complement health services in Loreto? To have trained nurses to care for each patient with the best quality and professionalism. Specialist doctors from various areas without needing to go to another city. That would be my dream goal for Loreto. That I'm able to get help from other specialist doctors. So the patient do not have to go somewhere else and that I don't know what happened to my patient. An ultrasound on call, lab on call. So at least know that if a patient with a heart attack comes in the middle of the night, I have somebody to rely on to get blood work or an EKG or an ultrasound. This to ensure that the patient receives the best quality of healthcare. There's going to be 2 really quick videos of examples. It doesn't have to be a Mayo Clinic. It doesn't have to be a St. Luke's Hospital. The next one, it can be just like this. This I got it from internet. But imagine a place that has a lab, an X-ray area, doctors that we can call and have an equipment. Imagine going in and saying, "Oh, I have an appointment with a cardiologist. I have an appointment with a dermatologist. I have a patient." They're not gonna be there all the time, but knowing that every certain weeks there's gonna be one doctor coming in, it's better than because most of the things that do not require emergencies would be great if we can be treated in here, right? So I was looking yesterday, and I found so many areas of this or clinics that have everything on one building. So I don't have to tell my patient, okay, now you're gonna go to this lab to get blood work done. Then I'm gonna meet you at the hospital to do the X-ray, and then we're gonna go to Dr. Franco to do the ultrasound, and then you're gonna come back. Forget about it. So this would be the acting dream asset for Loreto at this moment. To try to make a team of specialists to be coming over. And I have talked with so many. The good thing about being here for the last almost 9 years is that I have made good relationships with other doctors. And there's a lot of them willing to say, hey, I'll be part of it. Just name it and I'll be part of it. I'll go, and there's already doctors coming in. Like a lot of you don't know Dr. Mendoza, the orthopedic. Great doctor. I know a lot of you know Dr. Olivares or Dr. Cuevas, the cardiologist. Now there's another one coming in. There's a recent ENT urologist that just added. Like I said, it doesn't have to be through me. There's other pharmacies that are asking them to come. But at the end, if we have a place where we can tell them, hey, come on over, you have a place to see patients, they will love it. In Guerrero Negro, the doctors that go all the way to Guerrero Negro, they go from La Paz. So why don't they tell them, hey, Loreto's on the way. Just make a stop. Right?
Doctor here, Dr. Jimenez, who actually did work for St. Louis and Cabo and left them to come here and start a little clinic.
Exactly the work. He's a great doctor. I have met him before. He's a really good doctor. He's a general physician. He doesn't work for any hospital. So he can do a lot of things on his walk-in clinic, but at the end, again, he's not a specialist and he's not able to send any patient to a public area or anything like that. So yeah, that's the problem with that. He has limitations also.
So I love it. I love it. Is it something that you'd really be willing to make possible
Yeah.
if we could step up and help finance it?
Just yesterday, I have a quick talk with Dr. Prado. Again, he's an internist. He used to live in here. And he said, what do you need? Cardiologist? You need, we have a small chat on WhatsApp. And there's like 7 doctors. And they said, hey, we'll join your idea and we can go to Loreto once a month. It's better than nothing. You would say, once a month, doctor? Well, it's better than nothing. No?
Say you have a dialysis unit, there's nephrology.
Yeah. Yeah, so forgot to say that. Dr. Almanza, he's a nephrologist. Mhm. He works at the IMSS institution.
So in terms of like routine prescriptions, statins, blood pressure medication, that kind of stuff, I live in the US, I have on, ongoing prescriptions. If I run out of something, do I have to come say see you?
Well, the beauty about Mexico, I'm not gonna say beauty because that sometimes puts at risk of us doctors, but there's a lot of medications, blood pressure, diabetes, heart problems, do not require prescription. If you just bring your bottle that has the name of the medication and the dosage, and you go to the pharmacy and say, hey, I want more, they'll sell you more. In most, the things that requires prescription are antibiotics, are neurological, like for depression, for anxiety, things like that, and control prescriptions for like sleeping pill, painkillers, morphine, things like that. But most of
How about anticoagulants like? with
them,
that
no
stuff?
need.
So no-
Xarelto, Eliquis, do not require.
And
Yeah.
thyroid.
Thyroid do not require. Just, this is what we always said, doctors. If you're gonna go to a pharmacy without a prescription, make sure they give you what you need. Because in Mexico, not in Loreto, in Mexico, the people that work for the at the pharmacies are people walking by. Hey, you need a job? Come over here. We'll give you a job. They're not chemists, they're not nothing. They're people working, sometimes even like 17-year-old kids that need a job. Hey, come on, I'll give you a part-time job. So if they see something, oh yeah, this sounds really close from what I saw. And then sometimes they'll do it just to sell. I'm not gonna lie.
To come go and see you or a doctor.
You can.
See if it matches.
Exactly. Exactly.
If it's the same.
If it's the
name,
same, just quick, oh, can I get this? Yeah, sure.
or you have to get this.
Exactly.
equivalent.
Exactly. Mhm. Questions?
You want to add?
So, well, just really quick, I know I've taken a lot of your time. For the ones that don't know, I do have a medical concierge service. A lot of you already are part of it. It's a concierge in which we created, well, lovely people like you created it many years ago now. And it's a membership in which you decide to be part of it, and I become your general physician in case, let's say you have a problem. What do I do? Call Dr. Salinas. It's mainly about emergencies, but it's about making your life easier when it comes to your health. It's an insurance that you pay a monthly fee and you become my patient, and I make sure I help you with anything that you need. Small thing, big thing.
What if you're not here 12 months?
When I leave, when I do get to leave, I coordinate with other doctors.
No, what if we're not here?
Oh, no, you only pay for the amount of months that you're here. I mean, if you say, I'm gonna be only here 2 months and I leave, you pay those 2 months, you leave, and then when you come back, I'm gonna be there another 2 months. Okay, so then you pay another 2 months. Yeah, it's a monthly fee, and yeah.
I think this form is on the HOA website.
Salina?
Mhm.
I was just thinking of this great idea that you had about this clinic.
Mhm.
You know my mother well.
Mhm.
She has offered at many different times transforming her building that she has here in Nopolo for a space of that
Wow.
nature. You could have a conversation.
She's a lovely woman, and yeah,
You could have a conversation.
I would be amazed.
directly.
That would be great because that would be at the starting point, and I would love if she could. I would definitely talk to her because I'm a really good friend of her. Mhm. Any other question, doubt? Mhm.
We have been with Dr. Salinas since the day this program started. And he has helped us many times, including surgeries. I've talked to more than a few people in Loreto Bay that said, we don't pay him for his concierge service. Because he's so generous with his time, we get the service anyway. Don't be penny wise and pound foolish. He needs to make a living, and that's how we keep him in this town.
Thank you. I appreciate it. Thank you. I really appreciate it because
one more, you know, if anyone else is really interested in seriously helping this clinic be a reality, we're gonna donate heavily to this. If you are interested, let me know, and we'll have another smaller meeting with him and in the facility there to talk about making this reality, because I've only been in Loreto 2 years, and I want to stay here, and I want to have the medical care here instead of having to fly back to UCLA for it.
Thank you. I want to thank everybody so much for taking your time. I know I took a lot of your time today. I hope that I was able to answer a lot of your questions. Feel free to call me, send me a text, stop by. I mean, I'm really here to try to help you make your life easier. Also, feel free to see Osvaldo. Like I said, he made the effort coming in from all the way from Tijuana to answer any of your questions about airback evacuation. So thank you very much, everybody. I appreciate it.
Oh.
Oh, the concierge form.
Yeah.
Give me your email and I'll get it to you.
Yeah, I'm setting up for today's examination tonight, and I don't think there's anything in the examination. Any activity.
Oh, I don't know. I have it till 3, right?
Yeah, and we start at 6. So I don't think anything else if there's not. I would leave the chair.
Yeah.
You want to leave it there?
Thank you. Yeah, so let me just make sure, but I'm pretty sure because there's nothing else.